Hey everyone, I'm Aquila Battle, board certified family nurse practitioner, and welcome back to Code Red Nurse Mentor YouTube channel. If this is your first time here, Code Red Nurse Mentor YouTube channel is a channel that is all things nursing, anywhere from nursing courses, exams, to NCLEX, and helping you get into that first position as a nurse practitioner, LPN, or whatever field that you have decided to focus in nursing. If you want to know more about Code Red Nurse Mentor YouTube channel, please head on over to the first video that I posted last week, and it'll tell you everything you need to know. And do me a favor, watch this video until the end and you'll find some important information about how you can be directly involved with Code Red Nurse Mentor and Support Group. So with the help of the mentees at the Code Red Nurse Mentor and Support Group, I decided to make a video that outlined the educational pathways to nursing. So if you watched my first video, you learned that I am a wife, I'm a mother, and I work full-time. And trust me, all of those things were true when I first decided to obtain a nursing degree. I had a lot of competing priorities, and I needed a program that would not disrupt my own personal life too much, but that allowed me to be successful and swiftly move through a nursing program. So I found a 2-year program that allowed me to gain my associate's degree to become a registered nurse, to work in a hospital or wherever registered nurses were allowed to work in 2 years, okay? So I did that, and I started working as a registered nurse in various different areas. And then I decided that I wanted to advance my degree because I learned that there were certain ways you can function as a nurse with a bachelor's degree versus an associate's degree. So I went back and gained my bachelor's degree. I started working at those higher level positions as a bachelor degree trained nurse. And I honestly decided some of the areas that were open to me, I didn't like them. But I still love nursing. So I decided again to go back to get my master's degree to again work at that higher level. But my focus and what my focus has always been in nursing is to serve the patients and to be close to the patients. I love patient care. I love talking to patients. I love learning about them. And I love being able to offer them the best care that I can possibly give them and walk away from a situation with the patient knowing that I've given them everything that I had to offer at a high level for them to be successful in taking care of whatever issue we were dealing with at that time. So I went back to school to gain my master's degree, and my initial focus was nursing educator, but then I decided I wanted to stay face-to-face with patients. I love patient care. So I switched my focus early on to family nurse practitioner. So I graduated, took my certifications, and became a board certified family nurse practitioner. And now I'm at the point in my career after developing Code Red Nurse Mentor Group and Community Health Education Program that I want to still function at a higher level. So there's one more step that I need to take in order to reach the height of what a nurse can attain educationally. So I'm enrolling in a program to get my doctorate in nursing. So enough about me and my educational pathways to becoming a board certified family nurse practitioner. This video is about you and me offering you the choices that you have to work in the field of nursing. So there are a few different degrees and diplomas, certificates that you could obtain to function as a nurse in the field of healthcare. The first is LPN, Licensed Practical Nurse. The second is associate degree trained nurse, which will allow you to function as a registered nurse. The third is a bachelor degree trained nurse, which again will allow you to function as a registered nurse. And then there's a master degree trained nurse, which will allow you to function at a higher level than a registered nurse. And then there's the terminal degree of a doctorate, which is the doctorate in nursing that allows you the opportunity to have folks call you a doctor. Okay, so let's discuss these a little bit. Today in this video, I'm going to give you information about school commitment, career responsibilities, and the various places that you can practice as a diploma, certificate, or degree trained nurse. First, we're going to talk about the licensed practical nurse, or the LPN, or depending on what school you attend, the LPVN, which means licensed practical vocational nurse. So what's your school commitment? The school commitment for the LPN is anywhere from 12 to 18 months. Yes, you can function as a nurse within 12 to 18 months of schooling. That's amazing. The schooling itself prepares you to sit for the NCLEX because you do have to take the NCLEX and become certified with the nursing board in your state. So what are the career responsibilities of an LPN? Well, an LPN are tasked with the routine care of a patient, and that's care where the care plan has already been developed. Although in school, you will learn how to develop a care plan. What do those responsibilities entail? Well, they can be anywhere from vital signs, IV administration of medications or IV fluids, oral medications, catheter insertions or removals, or wound care, simple to complex. But you are also tasked with evaluating the outcomes of any interventions that you have performed according to the care plan. You are a tremendous assistance to registered nurses and medical doctors, and you are the supervisors of any certified nursing assistants in the facility. An LPN can practice in a long-term care facility, in medical clinics, and in home health care. But as a side note, I know a few amazing LPNs that run their own businesses in teaching certified nursing assistant courses or CBRF courses. So there are tons of opportunities there. So next is the associate degree trained registered nurse. The school commitment for this degree is 2 years. But there are some colleges that offer an accelerated course, which you can obtain this degree in as little as 20 months. So let's put this school commitment in perspective as it relates to the LPN program. So the LPN program, you can obtain your diploma or certificate within up to 18 months. If you add on 2 extra months, if you're able to commit to 2 extra months, you can complete an associate degree accelerated program as a registered nurse, and you would come out at a higher level as far as responsibilities and pay. And your training is at a higher level as well, affording you the opportunity to master tons more skills as it relates to becoming a registered nurse. So the things that you have to think about when deciding to become a registered nurse is 1, your current lifestyle and how that will fit into your current lifestyle, and what sort of adjustments you will have to make to be able to complete either the LPN within 18 months or the registered nurse associate degree trained from anywhere to 20 to 24 months. That's completely your choice, and that's something that you have to think about seriously before you enroll into a program. It's the difference between you being successful and not being able to get through a program to become a nurse. The associate degree program for registered nurse does prepare you to sit for the NCLEX. Yes, you have to take the NCLEX exam as an associate degree prepared registered nurse. So what are the career responsibilities for an associate degree trained nurse? So in nursing, in registered nursing, we follow what we call the nursing process. And there's an acronym that we use for that, which is ADPI, which helps us remember that we are in charge of assessing the patient, coming up with a nursing diagnosis, planning, carrying out interventions or implementing interventions, and evaluating the patient. This is an ongoing cycle for registered nurses because you can plan an intervention, carry it out, and evaluate only to find that you didn't reap the outcomes that you thought you would, which means you have to go back and do some readjustments to promote better outcomes for your patient. The registered nurses are the only ones who are allowed to develop the initial care plan for a patient. And in doing so, you are allowed to delegate certain responsibilities and supervise LPNs and CNAs. Also, as a registered nurse that is associate degree trained, you will be responsible for interdisciplinary communications and collaborations, which means that you will be consulting with other folks in healthcare that are directly assisting your patient. And that can be anyone from a physical therapist, occupational therapist, speech therapist, medical doctor, surgeon, and other registered nurses involved in your patient's care. You, as the registered nurse, are the manager of care, because as a registered nurse, especially in a hospital setting, which is where we function the most, you are with the patient more than any other of those disciplines. So it's important for you to be on top of everything that is being carried out as far as healthcare as it relates to your patient. You're responsible for the same skills that an LPN functions at, but at a slightly higher level. So in addition to those skills, you're going to be doing things like G-tube administration and removal, G-tube administration of certain medications. You're going to be responsible for IV setup and administration, including medications that LPNs cannot infuse, and certain fluids or blood products that LPNs are not authorized to infuse. So again, you're functioning at a little higher level. You will definitely be involved in complex wound care, including wound vacs, initiating them and changing them. You'll also be responsible for trach cares, which LPNs are responsible for those as well. But depending on the facility, sometimes they reserve things like suctioning as it relates to trach cares to the registered nurse who is trained at a slightly higher level than the LPN was trained. As a registered nurse, you are able to function in tons of different healthcare organizations, and this includes hospitals. You can work in the ER, you can work in acute patient care, pediatrics, you can work in home health care, again, as managers of care. You can work in long-term care facilities. Nurse. You can also work in medical doctors' offices as a triage nurse. Let's talk about the bachelor degree trained nurse. So what's your school commitment as a bachelor degree trained nurse? If you are right out of high school and you want to obtain your bachelor's degree as a nurse, you should plan to be in school for 4 years. And at the end of those 4 years, you will be able to sit for the NCLEX, which is the Nursing Board Certification Exam. If you have decided to move forward with your bachelor's degree in nursing and you have already obtained your associate's degree in nursing, plan to be in school anywhere from 18 to 24 months, and you will not have to sit for the NCLEX again, because you've already sat for it as an associate degree trained nurse, and it's the same exam. Isn't that wonderful? No NCLEX is something to celebrate, though. You'll get that once you start your nursing program. You are afforded all of the same responsibilities as an associate degree trained nurse. A lot of times you come out with the same pay as an associate degree trained nurse. So that's something to think about when you're thinking about what program is best for you in relation to the associate degree trained nurse. Your responsibilities, though, or what you're allowed to do as a bachelor degree, and the difference between being associate degree trained and bachelor degree trained, is that at this point in your career, you're able to apply for a position as a manager in a healthcare facility such as a hospital, or even a lot of times in a medical clinic. As associate degree trained nurse, you do not qualify to be a manager. You may be able to apply for a supervisor position, but a lot of facilities restrict you from applying for a manager position unless you are bachelor degree trained. So if that's something that you are interested in, managing not only patients, but other nurses and disciplines within a healthcare organization, then becoming bachelor degree trained is very important for you to plan out as far as your educational path to becoming a registered nurse. Okay, we're almost done. We're almost at the end of this. Like I told you, there are so many options and so many educational pathways to becoming a nurse. That's a wonderful thing about being a nurse, is you do have options. So hopefully one is right for you and nothing discourages you from attaining your dreams and reaching your goals. The next one is the master degree trained nurse. And if you are coming right out of high school and you want to obtain your master's degree as a nurse, plan to be in school for at least 6 years, okay? But if you've already obtained your bachelor's degree in nursing, then plan a school commitment of anywhere from 18 to 24 months. Thirdly, there are also programs that will take you from RN to MSN, which means you can have your associate's degree as a nurse and bridge to an MSN program in as little as 3 years. All right. So with a master's degree as a nurse, you do have to pick a focus. And as far as what I'm aware of, there are 3 focuses that you can pick. You can pick to be a nurse practitioner, or you can pick to be a nurse educator, or you can choose to be a clinical nurse specialist. All of those offer a little different pathway as it relates to the completion of your degree. For instance, a family nurse practitioner is very clinical heavy. So you do have to complete quite a few hours of clinical practice and practicums, which means you partnering up with other nurse practitioners who are already functioning in that role, or medical doctors to help train you through various areas of healthcare, including pediatrics, OBGYN, family practice, internal medicine, so on and so forth. As a nurse educator, you do not have to go through all of those clinical practice. Clinical nurse specialist pathway is slightly different, but very similar to that of the educator, because you are qualifying yourself to be a specialist in things such as patient advocacy, education of new nurses, onboarding to different hospitals or healthcare organizations, being up to date on new advances in healthcare, knowing a lot about managed care and insurance, and being a support to managers on hospital nursing units, so on and so forth. So it does depend on your focus. But again, if you are already bachelor degree trained, plan up to 24 months or 2 years in a master degree trained program. As far as an NCLEX for the master degree trained nurse, again, it's going to be a little different depending on your focus. But as for a focus of a nurse practitioner, you don't have to take an NCLEX, but you do have to take a board certification test, which is offered to you by the ANCC or by the AANP, which is the American Association for Nurse Practitioner. Each of these groups offer a slightly different type of NCLEX style board certification test. The same anxiety and preparation that you would have and need for the NCLEX, you have it for this. So you do have to sit for that, and the same rules. The rules are similar to the NCLEX. Like if you don't pass it the first time, you have to wait a certain amount of days to retake it. There's a limit on the amount of times that you can take it. You do have to pay for this test, but this allows you to be nationally board certified as opposed to the NCLEX, which allows you to be licensed and certified within your own state, or if you have a compact license, a group of certain states. So you do have to sit for not the NCLEX, but for a board certification if you choose the focus of a family nurse practitioner. In addition to taking the National Board Certification Test either through the ANCC or the AANP, you also are required to take a test that will give you a license to prescribe medications. Prescribing medications is the difference between being a registered nurse and a nurse practitioner. Although we can prescribe medications, order tests, we manage care as if a physician, the same way that a physician would manage care. But what sets us apart, because we still are registered nurses, is that we have the advanced practice nurse prescriber license. So you do have to sit for that license as well as sitting for the National Board Certification license. Okay, we finally made it into the end of the different educational pathways to becoming a nurse. And the highest that you can go, your terminal degree, the final degree that you can reach as a registered nurse, is the Doctorate in Nursing. So the school commitment for a doctorate in nursing for a student or a young man or woman who would like to have their doctorate in nursing right out of high school would be an 8-year commitment. And it could be a little longer or a little shorter depending on your focus. But if you have already obtained your master's degree as a registered nurse, you cut that 8 years down to 2+ years, anywhere between, let's say, 15 and 20 months, give or take a few months. The master's degree program requires anywhere from 48 to 60 credit hours, okay? And depending on if you were previously trained as a nurse with your master's degree and what course you took will determine how many hours are required for you to get your doctorate. So, for instance, if you are a master's degree trained nurse practitioner, you have gone through a lot of clinical practice and rotations and experience, which helps you as far as knocking off some of those required credit hours as a doctorate trained nurse. So your requirement would be probably about 48 credit hours. But if you were trained as a master degree nurse educator, the educator program, master degree trained, does not require clinical rotations and practices. So because you have not obtained that portion of a degree, you will be required to obtain that in those experience and clinical hours as you're trying to get your doctorate, which means that your clinical hours or the expected clinical hours will be closer to about 60 for you. So it does depend on your previous experience and what focus you have taken as a master degree trained nurse. So although you do not have to sit for another board certification, especially if you have already obtained a nurse practitioner, a nurse educator, or a clinical nurse specialist degree, as a doctorate prepared nurse, you do have to complete a doctorate prepared nursing project, which means that you have identified a healthcare concern that affects the community that you specifically touch. And you've done your research, you've consulted with other physicians, you've talked to patients, and you've gathered information that has helped you develop a plan for change. It is important to be able to identify issues in healthcare that need to be changed to improve healthcare outcomes. And you have to prove yourself to be a change agent and to influence those sorts of things. So you do have to create this project and present it in front of other doctorate prepared nurses and medical doctors. And you have to be compassionate, do the research, do the work, and speak to this issue that concerns you and the people that you directly touch, so that you can successfully pass or complete the doctorate program. It is a requirement in order for you to complete a doctorate prepared nursing program. So let's talk about career responsibilities and opportunities for a doctorate prepared nurse. Again, you are at the highest level of nursing, but let's say that you're already functioning as a nurse practitioner and you decide to go back and get your doctorate. Your responsibilities, if you decide to stay in the position that you're in, will not change. And honestly, if you decide to apply for another nurse practitioner position, your responsibilities will not change. Becoming a doctorate prepared nurse is really a personal journey. It's a way to kind of level yourself up and to have a better understanding and comprehension of not just your day-to-day nursing practice, but the overall impact that you have as a nurse in the field of healthcare towards your patients and other healthcare workers. You can influence things, and you get a high level of respect if you have the DNP at the end of your name. But as it relates to being a nurse practitioner, your responsibilities for the most part do stay the same. But let's say that you were a nurse educator and you decided to get your doctorate in nursing. You can still remain a nurse educator if you would like, but as a doctorate of nursing, you have qualified yourself to fill out an application to become the dean of nursing at a nursing program or a nursing school at a college or university, which means you are overseeing the entire nursing program from LPN to master prepared nurse, and some also have doctorate prepared nursing programs. You do have the right to demand more compensation as a doctorate prepared nurse practitioner or nurse educator because you have taken that step to advance your degree. And the other thing that you are allowed to do as a doctorate prepared nurse, which is more than exciting, and it comes with a little bit of controversy within the field of nursing because everybody has their own opinion about this part of becoming a doctorate prepared nurse. Having a doctorate as a nurse is an academic title that you have your doctorate. But a lot of nurses who are doctorate prepared do require that you call them Dr. something. Okay? Like, for real. So let me tell you this just as from personal experience, okay? I am obtaining my doctorate degree. I'm currently enrolling in a school to obtain my doctorate degree right now. When I get finished, I am Dr. Battle, okay? Anybody got a problem with that? I'm Dr. Battle because I have worked my butt off to obtain a doctorate degree, and I want to be acknowledged as such in an academic setting and outside of an academic setting. And not to mention, I am a nurse practitioner, so I am doing everything that your medical doctor is doing. I'm Dr. Battle. That's it. We finished. So there you have it. I have just outlined the various ways that you can become a nurse, whether it's diploma, certificate, or degree trained. If time commitment has been a deterrent for you to becoming a registered nurse, there are programs out there that are available and will cater to you having a family, a full-time job. Yes, you still have to make a commitment. Yes, you're going to have to commit time outside of your actual classwork to studying and focusing on different nursing courses, skills tests, and even preparing for the NCLEX. But it is manageable and you can do it. So don't let that be. No more information about Code Red Nurse, please head over to our website at www.coderedrn.com and learn a little bit more about us. We're also on Instagram at Code Red Nurse, where we give a lot of information that'll help the community live with chronic disease, as well as information about nurse mentoring. Again, we are here for you. Anything that you would need that would help you successfully enter a program, get through it, take your NCLEX, and enter into your first position as nursing is what we're all about. Thank you again so much for watching. I really appreciate it, and I'll see you guys next time.